My name is Melendez. I graduated from medical school in the 1980s. I've been living in McAllen, Texas since 1965. My father was a physician in the community for many years. His father was a physician for many years also. And so I've been in this population for quite some time. I currently serve as the health authority for Hidalgo County, which is the public health officer, as well as I'm a hospital-based physician. And I cover emergency medicine. I'm trained as a family physician here in Texas at Baylor College of Medicine. And I've done most of my professional career in the United States and the last 20 or so years exclusively here in the Rio Grande Valley. My rotation is very interesting because I'm in contact with the medical community. There's approximately 1,500 practicing physicians in our community. We're a community of 1.2 million people. We have over 2,000 beds in our community, of which about half are available through the SJSM system, which is our local partner with St. James and providing these clinical experiences. So the experience that the students have with me are quite diverse. It depends exactly what their level of interest is. Currently, for example, I have students that follow me into the emergency department that manage patients on the medical wards and that are involved in public health. As we speak, we're working on 5 publications that are looking at the public health parameters in our community of 1.2 million people and how COVID has impacted us and why that has occurred. What are the comorbidities? Most people don't know that the Rio Grande Valley is the 5th largest metroplex in Texas, that we have about 1.6 million people in the entire valley. We serve 1.2 million, and that we have liver transplants, kidney transplants, we have multiple residency programs, and that this is medicine is the 3rd source of income in our community and probably the largest employer outside of agriculture. We are, once again, the 5th largest metroplex in the entire state, and we're a very sophisticated medical community. And in fact, we draw from about 300 miles radius of people coming to look to our 11 different hospitals in this community with 2,000 beds to provide this level of care. So when you rotate with me as a student, you have the opportunity to be clinically involved and supervise decision-making roles and involved in publications if that's what you wish to do. I believe that the best way someone can learn is to see and then do. The resources that I offer my students is to see what I'm doing and then they do it. I also like to teach the students about the business of medicine. I have a master's in business administration and my concentration was in medical administration. And so I like for the students to look at the actual different healthcare delivery systems, the financial impact behind them. I like for them to learn about contracting, what it is to go at risk with certain contracts, what the different type of insurance companies are, what their line of services are, how you can incorporate that in both your private practice in the office as well as in the hospital, so that you can make not only decisions based on your intellectual interests, but also to keep in mind that there's also a financial parameter in medicine. And so I believe that with these 3 resources that I bring to the table to the students is that they get perhaps a longitudinal type of training that incorporates what is really real in medicine, which is not only the love and passion that it takes to take care of patients and the intellect and the wisdom that must lie behind it, but also the practicality. You know, what is it that is going to keep the doors open? And where do you find that balance of finance versus service? The concern that students may have between a balance of inpatient and outpatient is universal. And for that particular reason, in today's world, 2021, in the United States, and that also includes Valley, most people have chosen to do one or the other. For that reason, hospitalist services exist. Hospitalists, as you know, are composed usually of primary care physicians, usually internists and family medicine trained people. And so the students that come to my rotation will do vast number of primary care and public health. And so the balance in my rotation is really quite easy. It's mostly inpatient with public health. My experience that I can share is based on 20 years of emergency medicine and over a dozen years of really doing hospital-based medicine. I was providing hospitalist care before there was a hospitalist system. And so I too, like most students, when doing my rotations, I loved everything I rotated in. And so if whatever particular rotation I was in, I wanted to follow up with that as a career. As you go through the system, you realize that you have to choose where your fundamental knowledge is going to be at. I would like to help these students with that decision by helping them look at what the different criteria is in choosing a specialty. First and foremost, to try to divorce them from the financial aspect of it. A lot of the times we're confused because we're under the misconception that one specialty provides higher revenues than another specialty. Another misconception that people have is that one specialty is embodied by a certain commitment that other specialties are not, whether it's time away from your family, risk, etc. And based on my experience, because I think that what strikes real to students is someone that has walked the walk, not just talked it. And I am very well prepared. I'm not going to say convinced, but to show evidence that if you follow your choice with passion of what really rings to what you like to do, that the other aspects of criteria will fall in place. Whether that be where you can live in the country, rural versus urban, financial reward, time with your family. I can explain to students how they can schedule, set up their practice so that they can get what they're looking for. And of course, wherever you go, there's going to be some advantages and disadvantages. And as long as you go with your eyes wide open, I think you can make a more informed decision. And I think my role as one of their teachers is to open their eyes and to break away biases and to say, look, here's been my experience. And my experience is that you set your limits. People that come to this community to study are going to see the largest variance of pathology that is available. You will be seeing tropical diseases as well as those diseases caused by behavioral activities in first world countries. The people that you will be serving are people that are grateful that you're providing that service for them. Our 2,000 beds in our community, access to them are not limited by a person's financial ability. They're only limited to what their medical needs are. And so, of course, there's a reality of the financial aspect of it, but really for us, for the students and for the physicians, we just have access to a tremendous diverse pathology and a large, sophisticated medical community. When we're doing liver transplants, when we're doing kidney transplants, we're in the community, there are surgery, OBGYN, neurology, neurosurgery, family medicine, internal medicine, pediatrics, psychiatry residencies. We have fellowships in GI and cardiology. We are 2,000 beds, 11 hospitals, 4 major systems, the 3rd leading industry in the area. This is a very good place that perhaps if you would just pay attention to the headlines, you might feel that perhaps McAllen, Texas and the surrounding is not a very sophisticated medical place. I think that we have the advantage of having the resources from specialists, subspecialists, equipment, resources, different hospital districts, as well as the reason we're into medicine, the types of patients that we can treat. I think here you will set your limit on how hard you want to work and what type of patient you want to see. Also, we have to think beyond our training. We have to think about where do we want to be when we graduate and we're acting as attending physicians. Obviously, our hospitals that are involved in training physicians, those of us that train physicians, certainly there's not a financial motivation behind it. Our motivation is to establish long-term relationships with these students to stay in our community. And I can tell you that the average income of the physicians in this community is in the 90th percentile in the country. So this is a place rich in pathology and rich in opportunity. For people who are listening to our message is to encourage them to be proactive in looking for the places that they think that they would like to eventually end up living, and to not be led by biases that are the general information, but to really investigate and look what these different programs provide. I'm extremely confident that when they do that, they'll certainly see South Texas as a top place to want to come to.